Hi, I'm here today with Dr. Mariam Zamani, eye surgeon, aesthetic doctor, and the founder of MZ Skin. Thank you for giving us hospitality in your beautiful clinic.
Thank you for joining me today.
And I really would like to know, as a start, how your passion become alive to become an eye surgeon, a surgeon, and then what's your from eye surgeon to aesthetic doctor, how that transition came alive?
You know, I think everybody has a different journey. So it started in medical school. I went on a Operation Smile mission, which is a charity organization that goes around the world, and it operates on cleft lips and palates and kids in usually third world countries. When I came back from that trip, I knew I wanted to do something that would make people feel really good about themselves. One of my friends said, you know what, you can do oculoplastics. You go to ophthalmology and then you do that. So I started ophthalmology, and it was so much fun. It was very precise and exactly what I wanted, that immediate gratification. I know it sounds terrible.
No, I think it's great.
It sits in that, you know.
Yeah, like a tailor for the eye.
Yes, exactly. Fast forward, I do the oculoplastics, and I start working in the United States. I stay on faculty. And because of love, I moved to the UK, where I was very fortunate. I had a wonderful female mentor, Jane Olver, who I still to this day, you know, owe a lot of gratitude to. And I started doing research on hyaluronic acid and face in patients who had had facial trauma. So we were using, you know, strings, threads, injectables, lasers, all of these things to help improve their visual appearance from these different traumas. And I was like, this is so cool. There's so much you can do from going from zero to surgery.
And to help people to achieve a better looking self.
It's so important for self-confidence. You know, if you feel you look your best, you put your best foot forward. So that self-confidence it gave the patients really made me feel good. And then I decided I wanted to do a little bit more with dermatology. So I wanted to learn about the skin. And so when I came out of all of my training, I did another fellowship just on eyelids. I decided I wanted to combine all of those to really give a 360 approach to my patients. And the skincare actually happened by chance. I mean,
I remember I was a guinea pig. So because I know Mariam from long time, and I remember when she started to formulate the cream, and I was trying the texture, the smell. Do you remember? It was so fun.
It was so
little science.
Yes, little science in my house. Everything from my house. So after I had children, I had terrible melasma, and it made me, who had very clear skin my whole life, made me feel that I was dirty. And so I went from using these lovely brands my whole life to then using some of the doctor brands that had started popping up. And I went from loving skincare to feeling that it was very medicinal.
But I think what I like with the MZ Skin is that you have the medical approach with the luxury approach. So you combine those two together.
Well, that was the idea. I wanted to fuse science with the joy of the skincare ritual.
I want to ask you a question today because I know you are an oculoplastic surgeon and aesthetic. So what is the difference from blepharoplastic of upper lid, lower lid, because there is a lot of misconception, and who is a good candidate for that?
Great
and question. How, yes.
So blepharoplasty as a whole is a big word that it can encompass lots of different little tweaks in this procedure. An upper eyelid blepharoplasty is always when you remove a little bit of skin from the upper eyelid. Sometimes there can be some fat herniation in the corners of the eye from a fat pad, which can be either removed, adjusted, or actually not touched at all in the very hollow or very skinny individual. And then it can also encompass, you know, if there's some fat prolapse in, you know, in the brow area. So there's a lot of different things in that can be nuanced. You can add different procedures. So if your actual eyelid is heavy and you can't see as well, you can do a ptosis correction. Or if your brow is lower, you can elevate it with, you know, a brow lift. So it can be combined with different things. A lower eyelid blepharoplasty is a little bit more nuanced. So this can address fat or skin, or a combination of the two. So you can remove fat from an incision from the inside of the eyelid, which is scarless.
So right here, right?
But it's actually, I pull the eyelid down and I go from inside.
Oh, from inside, fantastic.
From inside, so there's no scar. And that's a really beautiful procedure for somebody who has that puffy lower eyelid. And
which happen a lot when you grow older, or sometimes it's genetic and it happen when you're young. I mean, the age matter or doesn't matter?
good question. So yes, it's like gray hair. Everybody gets it eventually. Some people get it in their 20s. Some people get it in their 60s. There is a genetic component to having puffy lower eyelids. If your mother, father, grandfather has very puffy eyelids, you can be predisposed to it. Certain conditions like eczema, atopic disease, where you've rubbed your eyes a lot, or contact lens wearers that pull down their eyelid all the time, because we actually have 3 fat pads in our lower eyelids. And there's a very thin sheet of tissue that holds everything back. When you're younger, everything's nice and lifted. As we get older, everything starts to,
you get like a teardrop as well,
you get
right?
a teardrop, but that's because the gravity is sort of, there's a downward descent of the face. And sometimes that fat starts to herniate forward. And when it starts to herniate forward, you can get that puffiness and you can get that demarcation of the tear trough. And so if you're somebody who just is young, for instance, and has puffy lower eyelids, I can go from inside of the eyelid, either remove it or redistribute the fat, and in a scarless procedure, you have a beautiful result. Once fat is removed from that area, it never comes back.
And now, what about here? Does it come back, the skin?
The fat does not come back. Now I'm going to address the skin. Very good question. So skin in the lower eyelid, I don't love to take or remove skin in the lower eyelid on most people.
Why?
So because usually the eye is a little bit unforgiving. It's the thinnest skin on the body. It doesn't have the same oil glands that you have everywhere else. And there is so much we do with our eyes. It shows our emotions. We chew with our eyes. We smile with our eyes. We blink thousands of times every day with our eyes. We flirt with our eyes. So, you know, the eyes are doing so many different things, and it's that elasticity of the skin and the quality of the skin that changes with time. And it also gets sun damage, because sometimes people forget to put sunblock on the lower eyelid and also on the other upper eyelid.
That's why sunglasses are very important to protect the eye.
Absolutely. So in the younger patient who has puffy eyes, I tend not to remove any skin. And in the older patient, if they have a lot of excess skin, then absolutely I have to remove it. Otherwise, they'll get, you know, sagging skin. But when you do remove a little bit of skin from the lower eyelids, at rest, you'll have less lines. But when you smile, you're still going to get those lines, because your skin is being pushed up, and it's the muscle movement that's causing those lines. It's not the actual excess skin, let's say.
So you use Botox to prevent the muscle to move, or what?
So what I like to do on the lower eyelid blepharoplasty for my younger patients, I tend to do an incision on the inside, so it's scarless. So you will never see a scar on the outside of the eye, which for women is maybe not such a big deal, because we can use, you know, makeup, either foundation, cover up, eyeliner. But in a guy, they don't want anybody to know that they've had surgery most of the time. And then if I feel that they have excess skin, but not that much, then I love doing an ablative CO2 laser treatment.
She loves laser.
I do love laser. I do love laser. And then in the older patient that has a lot of fat and skin, then I do end up removing a little bit of that skin. But then I also have to make sure that I anchor the corner of the eye, so that as you get older, you don't get a complication where the eye starts to fall downward,
that's not
which
good.
is something that can happen if you don't do a lower blepharoplasty well. And that's a complication that all oculoplastic surgeons really want to avoid.
And regarding upper blepharoplastic, once you remove the skin, does the skin come back eventually or not?
Great question. So this is something I tell all my patients. So upper eyelid blepharoplasty is a very rewarding procedure. I usually tell patients, if they do it younger, then, you know, early 40s, mid 40s, they're probably going to do it again. Can you do it multiple times? Absolutely, as long as you have skin. So you need to have enough skin from where your eyebrow ends and where your eyelashes are in order to have your eye function properly. Blink, smile, eat, chew, so your eyes...
Close your eyes as well when you sleep.
Yes, absolutely. So you can do it multiple times. If you do it on the earlier side, and you know, there are some people genetically predisposed to having that excess skin from a very early age. And I am very happy to operate on those people, as long as they know that, you know, they're probably going to want to do it again later. So yes, the skin does come back. It gives you a new starting point, but you do continue to age. And I sometimes say it's like gray hair, you know. We all get gray hair, and if you decide you want to dye it, it works for a while, and then you have to go back and do touch-ups. So,
of course,
you know, all surgery, even if you have a facelift, you never have one facelift and then never do anything else to your skin. There's really a maintenance that you need to do in order to
and
have
how
the
many
best.
years? Like 10 years, 15
usually
years?
Say blepharoplasty is between 7 and 10 years.
Okay.
It's pretty long lasting.
Yeah, it's good.
And the upper eyelid's beautiful because it's in the eyelid crease, and really once it's healed, no one can tell. It just gives you, makes
And where
you
is
feel,
the scar? Here?
It's in the skin crease.
Okay, fantastic.
It's a beautiful place to put it because we all have a natural skin crease, and I can show you some pictures later on. But it's really nice because it goes in your natural skin crease, and unless someone's looking for it while you're, I don't know, looking at a menu or your phone, no one's going to know you've had surgery.
Fantastic. And also you are a pioneer on fat transfer, I have to say. So what Mariam does, in my understanding, please stop me if I'm wrong, is that sometimes you take fat from the eye and you reposition somewhere else. Is that correct? And this is new in blepharoplastic because usually they would cut here, close, finito that. Yeah. But you are actually maybe moving fat around.
So, you know, there's trends as there are in all things, and we've gone in and out of loving fat repositioning. So it's not new necessarily, but okay. We're using it more and more, and I think the regenerative importance of fat has come back and is playing a very big role in medicine, aesthetic medicine, and also just in surgery. So yes, I'm a big proponent in the right individual to reposition fat, particularly in the upper eyelid. There are some lovely older ladies, for instance, that as they get older, their eyes become more hollow. Mm-hmm. So if you do a blepharoplasty in them and they're hollow and you remove some fat, well, you're just going to make them look more hollow. So in those people in an upper eyelid blepharoplasty, I tend to reposition the fat to give them a little bit of fullness. And actually, sometimes what I do is I remove fat from, you know, the inner thigh or a little bit in the abdomen, and then I place it at the time of surgery or even on its own in the tear troughs or even in the upper eyelids as instead of using a dermal filler, for instance, using their own fat. It's a nice adjunct to do when you're having surgery.
And this fat transfer is not only for the eyes, but you can actually do it for your face as well. So you take
temples, hands, décolleté.
What about the jawline?
Absolutely.
And it's much better than dermal filler, is that correct? What's the difference?
The difference. So, you know, I feel dermal fillers are getting a bad rap right now.
Very bad, yes.
So, you know, dermal fillers have an absolute place in aesthetic medicine. I would like to reiterate that done in the right hands and in the right proportions, it's a beautiful outcome, and you should not be scared of it. The nice thing about doing fat transfer at the time of surgery is that you have a more holistic 360 approach using your own body's fat, which means that you won't have an adverse reaction to it. Fat is not as precise as filler in some ways. When you put a certain amount of filler, you know how much filler you're using. Fat you inject, and some of it doesn't last. So we say anywhere between, 40 and 70% will remain, but then some of it gets resorbed over time. And as long as you know that, there's no problem with that too. And then fat also is nice because you can also, at the same time, you can get a larger quantity and kind of, if you need it in the temple.
Spread it around.
Or in the nose to mouth lines or in the periphery of the face. You can do a lot of those things simultaneously. Now, dermal filler is great as a non-surgical treatment because it's not surgery. You have no anesthesia. You come into my office and,
and immediately effect is like you look great,
yes,
right?
Yes, and, maybe it does take a little bit longer than we initially thought for dermal fillers to dissolve, and it does integrate into tissue, but that's okay because at the end of the day, as we get older, we have shrinking fat pads in our face. We have loss of skin elasticity.
Loss of bone.
Loss of bone. So the skin is hanging a little bit more than it did before. And everything is just a little less, plump. And so, and that continues, and there are certain ages in our life, particularly for women, where you hit these little milestones and you see a dramatic shift in how you look. And yes, it's absolutely wonderful if you can use a little bit of dermal filler and have a long-term effect. And why do we care if it lasts a little bit longer? I would be thrilled if I did my gray hairs, and as my gray hair was growing, some of it would
for a year.
Yeah, it would last for a year instead of a month. So I don't think that there's anything wrong with that. I also think that if done well, it can actually look beautiful. And sometimes I do say that dermal fillers look good until they don't. And so, you can have had dermal fillers and they look beautiful for 1, 2, 5 years. And then all of a sudden, something shifts, and maybe that's a shift in our aging.
They can spread as well, right?
It's not really spread, but I think sometimes when it's breaking down, it can hold on to fluid and water a little bit more. So you can sometimes see contour abnormalities. And sometimes then you need a slight little tweak and adjustment, whether it's in the form of hyaluronidase, which is a dissolving agent. So there are things that you can do. The nice thing about dermal fillers is if you don't like it, there is something we can do. We can use the hyaluronidase to slightly melt it. With fat, if you don't like the appearance, you have to wait till it goes away. It's very hard to reverse a fat transfer, for instance, in the face.
So I think with derma filler, the most important is do it where there is the lack. You have a lack of volume, and then you inject. But don't inject where you are volume, because otherwise it looks overdone.
I think that's the
and it retains
thing.
A lot of water as well.
Absolutely. I think, there's so many people walking around with beautiful dermal filler in their face, and they look fabulous. And so I think the biggest mistake is sometimes people think more is more. And I think with anything in aesthetic medicine, more is not necessarily more, and it's always better to be slightly undercorrected than overcorrected. So don't be scared of dermal fillers. They are a beautiful adjunct to any non-surgical and surgical treatment you have. Hands, earlobes, temples, chest, knees, arms. I mean, you can use them all over the body, and I don't think you should be worried about it. In terms of having future surgery too. The only time that I dissolve filler before surgery is when I have somebody who has fat herniation in the lower eyelid, and I've done a tear trough filler for them. And I do dissolve it about 2 weeks beforehand, just to see where their baseline is, to determine how much fat to remove, and whether or not we then should do a fat transfer or a fat repositioning in that area for the tear trough. So hopefully maybe they won't need dermal fillers later. So that's really the only time.
And that's most of a surgeon that they do facelift, they do the same. They remove the derma filler in order to see where is the lack, where is the volume, how much they can pull, correct?
And actually, I spent some time watching some really wonderful plastic surgeons doing facelifts. And sometimes, people forget that they had filler. They might have had it a long time ago and they forget. And when they're doing a facelift, they can see it, and it's just a clear gel. They just literally with their fingers remove it out. So
fantastic.
I'm not as worried about it as people on social media, sort of with that fear mongering. I think that they do it for that sensationalization, for you to listen a little bit more. But a good plastic surgeon really knows how to treat the face holistically, with or without dermal fillers.
Yeah, I think we need to be really careful about trends and go to someone who has got a degree and is specialized on that, so they can give us experience is very important.
Nothing replaces experience and your education.
Good. Think this is something that you need to take it with you, whatever you do. I want to ask, what about salmon sperm? Because everybody's like, oh, I'm doing salmon sperm, I'm so cool, and especially under the eye. What do you think? Does it really work, or is only commercial and a new trend like avocado on toast?
Avocado on toast I still love, by the way, and I still have it probably a little bit every day. So I haven't jumped on this bandwagon. Of course, I inject polynucleotides for my patients. There is not a lot of great data on it, to be absolutely frank. So the science is limited. That doesn't mean that maybe in the future we'll have amazing studies that will show that this is a wonderful treatment. But I think the jury is still out. People who do it, some people love it and they come back for more. And I will, of course, do it for them because they see the difference. But I always caveat it and say there's not that much science behind it right now. It's not salmon sperm. It's fragments from DNA, fragments of the DNA from different fish. And
it doesn't get you pregnant, don't worry.
Definitely not from you. But I also think sometimes it can be traumatic. The one thing that I would say in the eye area is that if you have those injections being done and they're not done really the way that they should be in the right hands, is that, remember I just spoke about that very thin sheet of tissue that holds the fat back. Well, if that needle keeps going in and out and puncturing the very thin sheet of tissue there that's holding all your fat back, and you're putting a liquid in there that's going to, even if it's temporary, have a little bit of swelling, well, then you may hasten the prolapse of that fat because you're creating little holes in that sheet that's holding things back. So I think you have to do it in the right hands. Somebody really, well versed in this needs to be doing it. And then if it works for you, great. Sometimes I tell patients, you want to try it, great, we'll try it. But if you don't see a result, don't keep doing it. So I say that with lots of things. So I love lots of other skin boosters like Profilo. I love Profilo for myself, but I know that in some patients it doesn't work as well.
Yeah, for me it doesn't work because it really makes me puffy. So based on experience, I will not do Profilo.
So there are other ones that you can do, and you know what? A different one, Revive, might be better for you. There's a lot of different skin boosters that are out there, so we can find one that works for you. The only other thing I'd say about polynucleotides is if you came into my office and I injected you with saline into your face, you would leave and you'd be like, oh, my skin looks amazing. Look how plump it looks. It's hydrated. It lasts, a little short period of time and it goes away.
So saline meaning water with salt, right?
Yes, injectable water essentially. So
exactly.
Sometimes I wonder if polynucleotides does that. I know that I am, I'm not going to be, cheered on for this, especially by all the companies. But I'm still, until I see the science and the data and it's in my hands, I'm a little skeptical.
No, but thank you for sharing this, because in this podcast I really want to tell people the truth, not the trend. So this is actually a very good insight.
Very trendy right now. I mean, I don't think it's going to do you harm. So
try it.
But I don't necessarily think, I think it's an expensive treatment with not necessarily the best known outcomes yet.
So would you think that collagen injection like Juvelane, so before it was Sculptra as well, are a better fit? And what is the difference between Sculptra, Juvelane and Dermafiller or salmon sperm?
So dermafiller is a filler. So it does exactly what it says it does. It's going to fill an area where you need volume or contouring. You can use it anywhere on the face. You can help recontour a nose. You can sculpt a face with it. It's a very precise location where you can inject your filler. It's usually made out of hyaluronic acid, and it lasts anywhere between 6 months and a few years. There are different kinds of fillers out there. That's the hyaluronic acid ones. Then you have things like Radius, Harmonica. There's different ones that are not permanent at all, but semi-permanent, meaning that you can't really dissolve them. Like a Radius you can't dissolve, but over time it becomes less and less. And then there's things like Sculptra and Juvelane that are biostimulators. So Sculptra has been around for decades, and it was first originally created for HIV and AIDS patients who had a lot of lipoatrophy, which means that they lost a lot of skin volume from fat. They were super skinny, they were very unwell, and they looked unwell. And they couldn't have dermal fillers because their immune system was compromised. And so the polyallactic acid was injected for them to create their own skin, because you can't have a reaction to creating your own skin.
So basically it stimulates your own collagen, right? Yes. And it works over time.
It works over time. It's not an immediate effect, although because it's mixed with saline, initially you see a little bit of puffiness or volumization because it's mixed with the water, but you usually need a series of injections to get to where you want to be, and then maintenance on a yearly basis. And generally for Sculptra in the face, we say, depending on your starting point, it's one vial per decade of life. People also use it for the bum. You need a lot for the bum to be able to get the result. It can be an expensive endeavor, but it works really beautifully.
How long it lasts?
It depends on the person and their health and well-being. But generally, it's, you do your loading dose, and then you do maybe 1 or 2 vials a year or thereafter.
Okay,
So
good.
it's pretty nice. The downside of Sculptra in the past has been limited in the locations you can use it, because sometimes the particles clump together. So after Sculptra, there's a rule. You have to massage 5 minutes, 5 times a day for the first 5 days in the area where you've treated, because the particles of the polylactic acid like to stick together, and sometimes they could make balls. And it's very concerning for anybody who can feel that they have like a little ball in their face. Now, if it's in your cheeks, you're not going to notice it. You put it underneath your eyes, and
Can you put it underneath your eyes?
You should not put it underneath the eyes.
Exactly. Do not do it.
Yes, because if you do, and I've had to operate on a few people now, where you have the little ball that creates like a little ball. It looks almost, like a pill underneath your skin, and even with different treatments, trying to break it apart with
with laser, radio frequency.
Laser doesn't help. Radio frequency potentially, but usually we try to stick a needle and either with saline or another agent try to break it apart.
And if it breaks, what happens?
No, but that's fine. Then the ball goes away.
All right.
But it doesn't work most of the time. And then to remove it surgically means you have to make a cut. And anytime you make a cut, there's a scar. Who wants to have a scar underneath their eyes? And in the temples too, you can sometimes get those balls, and it can make it look uneven. So that's why Sculptra isn't as popular as it could be. I do love it.
Don't you agree with me that before, so people use it, and then it became really unpopular, and now it's starting the way to come back up into a trend. Well, and then there's been developed into some other brands, Julaine, which is a big, me too.
So I'm going to talk about that now. So
I'm excited.
Now, also Sculptra is that we've learned better ways and techniques of making sure that you don't get it. I've also treated people with nodules in their neck. So you can have it hyper diluted in areas where you want to have improvement, so hopefully you don't get the nodules, and you have to be very vigilant as a patient to do the massage. Now, Julaine, I love Julaine. Julaine is also made from the same thing that Sculptra is made out of. It's polylactic acid. But instead of the ions of the particles coming together to create clumps, they actually repel each other. So you don't get that side effect of having it. Now, the only downside of Julaine relative to Sculptra is that after injection, for a day or two, you can be puffy. Some people love it, and then some people hate it.
But I didn't get puffy. So Profilo, which is completely different, makes me puffy. I had Julaine, and I had this instant facelift.
Yes.
I loved it.
Yes. So most people love it, but I also say in the very skinny, because you also have a nice heart-shaped face. But a lot of people, when they're very skinny and then all of a sudden they have some volume, they're not used to that, so they feel that they look puffy. But I always say it's short-lived. It's like 24 to 48 hours. Can take an antihistamine to help minimize it, but I love it because again it's a biostimulator. It helps your body create more collagen and elastin, so a really great adjunct to skin rejuvenation. And I will say one last comment about the Sculptra is now we're also using Sculptra topically after lasers, which is quite interesting.
Oh, really?
So we create the microchannels with a CO2 laser or an erbium laser, and we use a topical hyper-diluted amount of Sculptra and put it in to help build collagen and elastin, and it works really lovely and nicely around the eyes.
Maybe next skin, next cream for and the skin can be with Sculptra. Yes, that would be so good.
You need the channels. You need to be able to get into the skin.
So like microneedling, and then
not microneedling, because microneedling is usually done in a circular, like with a skin pen, it's done in a circular fashion. So you're not getting the precise, micro columns of injury that you do with a laser. So when you have a fractional or fully ablative, the fractional ones, you're creating a specific amount of tissue damage, but in a very precise line
and deep,
and
maybe
deeper. So you get that Sculptra in there,
because of course the skin has got many different layers.
Absolutely.
So the deeper you go with the laser, then the more if you put the topical Sculptra, the more it will penetrate into the skin. Fantastic. And there is so much again of a trend, because we are all about trend in our society with the social media. is GLP-1. So people are taking these GLP-1 peptides in order to lose weight or insulin control, and they start to lose weight, and then creates a loss of volume in the body and in the skin. Do you have patients that come to you and say, I've been taking these Ozempic, Wagonium, like they have so many names around it, and then have so much lost in my face. Mariam, what do I do?
So in the right patient, I love GLP-1 agonists, and I think that, you know, for somebody for so many different health benefits, it's great. Unfortunately, you can't control where you're losing the weight from. That would be amazing. And a lot of people, because you just have a decreased appetite, you're not having enough intake of your protein, and, you know, nutrition can be a factor. So I do think nutrition is really important if you're on any of those injectables.
And exercise.
And exercise, of course, to create and to maintain, you know,
muscle
mass and also bone density too. So very important. Now, if you are someone like that, I do think that actually things like Julian, the biostimulators, are very good. So sometimes if you've had a dramatic weight loss, there's nothing that you can do other than surgery. So if you're an older person who's gone and you've lost, I don't know, 20, 30, 40 pounds, or, you know, 10, 15, 20 kilos, and a lot of it has come off in your face, and you've lost a lot of, you know, facial volume, and you have skin, unfortunately, nothing in an office setting is going to really be able to turn back that time. There are things you can do to slightly improve it, but in reality, you're a surgical patient for a facelift. And what I do notice is that sometimes it's the eyes start to fall and the brows start to fall, and then, you know, yes, you're an absolute good candidate for surgery.
And do you think that's also for bone loss, not only loss of volume?
Yes, well, it's a combination of everything, and unfortunately, if you start losing bone, it is actually much harder to build up your bone density. What I would say is that in people who have lost weight, if you decide to go down the surgical route, you really should be within 5 to 7 pounds, you know, so a few kilos, less than 5 kilos essentially, of your ideal weight, because you don't want to be losing weight and then, you know, still on that journey and have a surgical procedure. So you'd want to be, same with pregnancy, by the way. You know, some people lose weight and they want to come 2 weeks after having a baby to have their blepharoplasties. I'm like, no, can you go back to where your weight is?
Yeah.
So it's very important to do that. Now, if you're just somebody who's lost a bit of weight and your face has taken the brunt of that, then absolutely. Things like Julian, things like Sculptra, and actually well-placed dermal fillers are an excellent combination to be able to revive your skin. Some energy-based devices to help tighten the skin. I love Ultherapy, which is an ultrasound.
I love Ultherapy as well.
It's a great treatment to tighten lax skin along the jawline. I've probably done it 5 or 6 times since my late 30s, early 40s. I think it's a really great treatment. Sometimes people have crepiness of the skin and different, you know, microneedling with radiofrequency, like a Morpheus 8, just as an example, or even lasers, fractional and ablative. But, you know, the goal is to improve the skin quality and create skin volume. And if you have too much skin, to remove some of the skin.
And a little bit of a lift.
Everybody loves a little bit of a lift.
But do you think for whoever injects GLP-1 is because the cause of loss of volume is because of the loss of weight, or actually these peptides can cause skin problem?
No, I don't think the peptides are causing skin problems.
Okay.
I think it's more, I think the thing is that you lose a little bit of volume everywhere. And there's some people who lose weight first in their face and last in their tummy. You know, tummy weight is usually the hardest to sort of shift. And so, but I think it's also because of nutrition. So a lot of them are not doing it in conjunction with a nutritionist or a doctor to really give them the guidance on making sure they maintain their protein intake, that they're doing their exercises, they're doing weight-bearing exercises.
Put cream as well, like, you know, hydrate your skin, because
skincare is the cornerstone of everything, regardless if it's surgery, injectables, lasers. I mean, your at-home skincare routine is really the foundation for everything.
You know, if you lose weight, I have this question, because sometimes it's the the skin of the tummy really gets really loose. It can happen after pregnancy, it can happen after age, many reasons. Even if you do exercise, even if you eat healthy for all your life, what do we do? Do we inject, I don't know, Profilo in the tummy? Do we do laser? Tell me the secret. I want to know.
So the worst is when you do a plank.
Yeah.
And
you have the skin,
the skin here or around the knees. So I think one of the advantages of being a woman in my perimenopausal 50s, early 50s, is that I know what my patients are going through, and I know what bothers people because it bothers me too. So then you have to make a decision where you want to spend your time and money. So I love exercising because it makes me feel good, and hopefully it'll keep me strong and healthy for as long as possible.
Even in your mind, not only in your body.
And then where I want to spend my time, because it takes a lot of time. You could spend a lot of time every single day doing a lot of things. So if the stomach is really bothering you, the abdomen, you can use things like Profilos, the skin boosters, the Julian, but you need something that has an energy-based device too. So that's where Morpheus 8 is beautiful, or M-Sculpt, because it uses radio frequency. Well, M-Sculpt is great because it uses radio frequency and the contraction, so you're building muscle and tightening the skin. But remember, these things only work so long as you're sort of using them. So you have to maintain them. You do the treatment, and then you can't do it once and then say it's done.
Consistency is the key in everything you do.
Everything.
And one and final question. Do you actually do what you advise your patient to do?
100%.
Yes.
So
that's why she's amazing.
So first of all, I would never offer anything in my office that I wouldn't do on myself. The only caveat is the polynucleotides. I have not done polynucleotides because I love so many different skin boosters. But pretty much everything else, I've tried it. Maybe not a whole treatment, but I've done Morpheus 8 for my tummy, and it works. I'm trying another laser right now, actually, for my tummy that we haven't gotten yet, but I'm seeing
if you need a guinea pig, I can...
Anytime. I may actually need one.
Good. I'm on.
So, I only advocate the things that I would do. I think that's actually really important. For me, it's about being my authentic self and to also help my patients be their best version of themselves. When you're younger, you have youth on your side, and you have a little bit of innocence. And as you get older, we all have so many different responsibilities with our families, with our work, with our friends, just our life. And, being able to feel confident when you get up in the morning every day really changes one's outlook. And so my goal is to have everybody feel their best. And I want you to be able to put your best foot forward, whether you can come to my office and do it or you need to do it at home with skincare. But it's about giving yourself those rituals, whether it's with exercise, with skincare, with lasers, with surgery. As long as you have a good group of people that you trust as your specialists, I think that's the most important thing, because there's a lot of noise out there, and there are a lot of experts that claim to know the answer to many different things. And the reality is that when you come to someone who has the actual credentials and the expertise, they may be a little bit sometimes more expensive, or might be a little bit longer waiting time to see them, but you're paying for their expertise, their knowledge, but also what to do in the event of a complication, because
that's the most important. When you see a good doctor is when you have a complication and how the doctor deal with it.
Absolutely.
I think that's very important. And what I love about your job, that you gift people with self-confidence and beauty, but not only beauty to make them look good, but to feel good.
Yes.
And that's the most important.
It's the biggest form of gratitude is when someone says, I'm just so happy with how I look. Or sometimes people come in and they have a mommy makeover or a post-divorce makeover, or it's just their birthday and they want to do something nice for themselves, and they're like, I just feel so good. And that's the best compliment that I can receive.
And I think what I like about your approach is that you personalize. As you say, not everyone is the same. So you find the best fit for your clients, which is most important?
I think everybody needs a different plan, just as an exercise. You can't do the same exercise for everyone and have the same result. So I think, being able to have a plan is important, but I also think prioritizing. I always tell my patients, they say, well, what would you do? And I say, it's not what I would do. You tell me what bothers you, and then we'll make a plan based on what bothers you, and we'll adjust them from, what bothers you first.
And the last one, what would you say? You are young, but what would you say to a younger version of you, say when you were in your 20s?
Nothing is as beautiful as youth. Just go out and have fun.
Good, I like that.
No, there are certain things, no, but what I would say, I would still say that. But the other thing that I would say is that learn good habits early. And the good habits that I think are important is consistency, like you said. I don't mind if you have a three-step skincare program, but keep it consistent and do it every morning and night.
Maybe remove the makeup.
Remove your makeup, have a good cleanser that can exfoliate, good hydration. If you have a skin problem, pigmentation, acne, rosacea, target that skin concern. Wear your SPF, hydrate. You can get a lot of that and not a lot of products. You don't need to use many. Like I said, you could even pare it down to 3 very good products. And SPF is a must, as your BFF, as we like to say. And then also invest in yourself with exercise and
good nutrition
and a ritual for yourself. And skincare can be a ritual, exercising can be a ritual, meditation can be a ritual, but make time for yourself, even if it's 5 minutes every single day. That is something that you will carry on forever and will always bring you back to your center core.
Which is the most essential. So thank you, Mariam. You have been so knowledgeable.
Thank you
and
so much.
Maybe I can
we
come
can
to
continue.
Yes, please.
To be continued.
Esatto. Ciao.
Bye.